My name is Yuri. I'm the Michigan Regional Organizer here at Vot-ER. And living in Michigan has really shown me that while we're steadily marching forward, that there is much work that still needs to be done to create more equitable outcomes for everyone. Here to share a bit more about Michigan and her experiences is Dr. Mona Hanna-Attisha. Dr. Mona is the founder and director of the Michigan State University and Harley Children's Hospital Pediatric Public Health Initiative, an initiative and model public health program in Flint, Michigan. A pediatrician, a scientist, an activist, and an author, Dr. Hanna-Attisha has testified 4 times before the United States Congress and was awarded the Freedom of Expression Courage Award by PEN America. She was named one of the Times Magazine's 100 most influential people in the world and recognized as one of the USA Today's Women of the Century for her role in uncovering the Flint water crisis and leading recovery efforts, and most recently received the 2020 CDC Foundation's Prize for Improving Health. She's a founding donor of the Flint Children Health and Development Fund, flintkids.org. Dr. Mona Hanna-Attisha.
Thank you, Yuri, for that awesome, wonderful, kind introduction. I am so excited to be here. And I'm already so inspired. I don't think we need any more. I mean, Aaliyah, this is amazing. Like, everybody who has spoken has inspired me, and I'm sure inspired all of us to get out there and to roll up our sleeves and to do this work. And I am just so excited to be here with all of you, to be partners in this work that, gosh, is probably the most important work that we're doing in health right now. So thank you for having me. I'm so looking forward to this fired up conversation.
Absolutely. It is a treat to have you, and we could not have picked a better person to send us off courageously into our health and democracy's journeys that lie ahead. And there has been a lot that we've already shared. And also, I think one of the most incredible journeys and stories around democracy and health in American history is the story of what happened in Flint. So can you tell us your story and what happened?
Sure. So I'll just take a couple hours and I'll share that story. No, I'll just try to be really brief. So I think a lot of you probably know a little bit about the Flint water crisis. It's been a while now. So in 2014, our water was switched to save money. And it was gross and brown and yellow, and it smelled and it made people sick. And it was happening for about a year and a half, and really brave people on the ground were saying, hey, there's something wrong with my water. And they're coming to the doctors and saying, hey, my kids are getting sick. And throughout, the government was saying that everything was okay. And then I heard about lead being in the water, and I did the research that kind of uncovered that our children were being poisoned by lead because of the super corrosive water that wasn't being treated properly. Met with a lot of resistance, but like Dr. Sharma, I don't take no. And I'm so excited to be with so many badass, persistent women today. We don't take no, and we don't take no, especially when we're fighting on behalf of our patients. And for me, it's kids. As a pediatrician, I wake up every day because of children. They're my why. They're the reason I went to school forever. They're the reason I'm here with you. And when I realized that there was something poison in their water that was threatening their tomorrows, that kind of enabled me to fight back. And eventually, the state conceded, and we uncovered this terrible water crisis. And since then, we have been working towards recovery. So that's kind of a quick synopsis of the Flint water crisis. But a lot of people see it as this bad thing that happened in the water. Lots of people spoke up. It's a story of resistance and kind of the ripple effect of our work, influencing the Infrastructure Act to remove lead pipes all over. So a lot of people know that story, but the beginning of our story is a democracy story. And that's what I want to share with you. So the reason that our water was switched in the first place was because the state was taken over by a financial emergency manager. And in Michigan, there was a ballot measure about emergency managers. The people of Michigan were asked, do you want emergency managers appointed by the state to come in and just take over your cities? And the people of Michigan said no. They voted down this ballot measure. However, our legislature, which was one of, but not for long, one of the most gerrymandered legislatures in the country, tweaked it and pushed it through, and it was signed by the governor. So at one point in Michigan, half of our African-American population was under emergency management. So I just want you guys to all kind of scratch your heads for a little bit, like, wait a minute, this is America. Like, this is not how America is supposed to be run. This is not democracy. Like, we're supposed to have elected and accountable officials making our decisions. Yet in many of our majority minority cities like Flint, like Detroit, like Pontiac, like Benton Harbor, they were under the control of unelected, unaccountable officials that were put into place against the will of the people. So it was the emergency managers that decided to change our water to save money. And after it was all uncovered, the emergency manager, one of them was actually subpoenaed before Congress, God bless him, Elijah Cummings, who was then chair of the Oversight Committee. And Congressman Cummings asked him, like, why weren't you listening to the people? Like, they were coming to you with like jugs of brown water and they were saying that they were getting sick. Like, why weren't you listening? And his response was something like, I didn't have to. I didn't report to them. I wasn't accountable to them. So I want to share this story because here is such a terrible story of what can happen to the health of our patients when our democracy is corroded. Not just our water is corroded, but when our democracy is corroded. And you may think that, you know, this is a bizarre thing that only happened in Michigan. And the reason that I wrote a book and the reason I'm here with you and the reason that I keep talking is to remind folks that this corrosion of democracy is happening everywhere. It is no different than all the other efforts that we have heard about that are taking away people's ability to have their voice heard, be it through voter suppression, voter ID, mass incarceration, gerrymandering. These are all other ways that make it really hard for democracies to be whole and representative. I'm going to recommend a movie called Slay the Dragon, which is about gerrymandering, and it starts with the Flint story. It starts with the story of how we lost our democracy and unelected and unaccountable officials, were making decisions that were not protective of the health of our population. So healthy democracies equal healthy patients. And that's why I'm sharing my story as a reminder of what's happening really all over.
Thank you so much for that. And, one of the tensions that at Vot-ER we're often wrestling with is that, in our work, there's now tremendous backing around healthcare-based voter registration and that component of the story. You mentioned, gerrymandering is part of this. What are some of the things that, recognizing the many multifaceted threats that are coming at democracy, what are some of the things that, you see as ways for pediatricians and others to take action and take on the responsibility and advocacy and civic engagement?
Oh, that's a great question. And so, part of my story is, when the people in health and healthcare spoke up, change finally happened. So our water crisis was happening for a long time. There was moms and pastors and activists and journalists and water scientists all saying, hey, there's something wrong here. And they were being dismissed and denied. And they should have been listened to. That first mom that said, my kid is getting sick and held up a jug of brown water should have been listened to. But when the doctor spoke, when the person with that long white coat got up and shared research and shared science and spoke on behalf of their patients that something was wrong, it took a while, but change happened. It's not how it should be, but it's how it was, and it's how it is in many places. In this era where so many professionals, aren't held in high regard, our field is still held in high regard. We are trusted and credible voices in our communities. And when we tell our patients to, read books to their kids or eat healthy or, register to vote, it takes a while, but they listen to us more than maybe other influences out there. And, Dr. Sharma said, it's also, I want to reiterate, it's a journey. And when she said, it doesn't happen overnight. It reminds me about like our vaccine work. Like I'm a pediatrician, we're bread and butter is vaccine of what we do. And even before COVID, like we'd sit and we'd have conversations and we'd listen to concerns and we'd have them back and forth. And maybe, they wouldn't vaccinate at the 2-month visit, and we'll still talk about the 4-month visit, but maybe at the 6-month visit, I finally convinced them. So, this is a relationship, a journey that we have with our patients to use our very trusted and credible voices to once again, to advocate for what's best for their health.
Thank you. So beautifully put. And actually, when you think about Krista's story in Kansas as well, it's like it was the health center saying this issue is important. This vote is important. It may be happening at a time you're not used to voting. Please go vote. So, a couple of months ago, the American Medical Association passed a resolution on voting as a social determinant. Our partner, the American Academy of Pediatrics, actually reaffirmed that resolution in the AAP body last week. And what can health professionals and pediatricians now do in light of these proposals?
Yes, this is awesome. This is wonderful news, something that we've all known for so long is one of kind of the root causes of what makes our patients sick. There's another quote that I love. It's similar to a quote that Dr. Sharma said, that pediatricians are the ultimate witnesses to failed social policies. Like it's in our exam rooms, it's in our in the hospital, in the wards, where we see the consequences of our failure to protect kids and to protect society. So how do we address that? We address that with civic engagement. We address that with a stronger, more representative, engaged democracy. So I'm so excited. Often when we have the backing of large professional organizations like the AMA and the AAP, it makes it a lot easier for us to advocate at our local institutions. It's so much easier when I have a policy in my pocket and I'm talking to my CEO. I'm like, or to my colleagues, I'm like, yeah, but the AMA says this is important. And the AAP also reaffirmed it. They're like, okay, well, if it's a guideline, we have to do it. So this gives us more power in our toolboxes when we're trying to increase our allies, especially in our health systems. So this is wonderful news. We need to add this to our social determinant screeners if we already have them. We need to include them in medical education at the UGME, at the GME level. We need to do more role playing and simulations about this, just as we saw. My residents get, training and advocacy. It was part of my professional training. We do role playing on how to speak to legislators about issues. These are things that now need to be built into the curricula to prepare people. Not only do we need role playing on how to do a lumbar puncture and simulation, but we also need to make sure that we are role playing and becoming competent in these other skills that once again play a huge role in our patients' health. We all know, I'm a former residency director. I still do a lot of work in medical education. And it's so humbling when we share with future, healthcare providers that, it's only a teeny tiny percent of health outcomes that are dependent on healthcare. It's all of these other social determinants that play such a huge role on the health outcomes of our patients. So I think folks in medicine need to be reminded of that often, and we need to once again elevate the fact that voting is now a declared social determinant of health, and supply the tools which you guys have to make that part of curricula.
Thank you. And I feel like, the last couple of months, if there's that scene in Lord of the Rings where like the ghost army jumps off of the ship and just rushes in, and there has been over the last few months just so many examples of the senior legitimacy of kind of the broader work, the AMA, the AAP, the AAMC's recent guidance, the National Medical Association, just so much that's happening that is brand new resources that we can take to health institutions and say, like, look, the work is being done. Our partnership with Health and Human Services that created guidelines for community health centers. So yes, just reinforcing for everyone, feel free to bring these different pieces, whichever one you think will resonate best, take it to your administration and leadership. You're not just the only one saying this. There is a bunch of other, people saying it with a different type of credibility or legitimacy in addition to yours that you hold as a local expert on your work.
Yeah. And I would just add, like, all of us in health and healthcare, it's been a hard few years, right? Like we're, there's a lot of talk about wellness and burnout, and people have left the profession. There's a lot of like shrugging the shoulders, like, what am I going to do? And for me, getting involved in this kind of work is an antidote to burnout. It gives us, it re-energizes us. It reminds us of that why we went into this profession, this service-driven profession. So I think this can be a cure for so much of what ails our profession, is getting involved in this kind of work, which, and advocacy work in general, to be able to realize these impacts that will have a huge role in the health of our patients.
Awesome. Okay, we have one last question from me, and then want to kick over to some of the questions that the audience has. The question that I have is, so I loved your book for so many reasons that are both personal and professional. And in your book, you mention your grandfather as an idealist and a humanist, and the positivity. And how do we stay positive? You kind of were starting to get at this in your last comment, but how do we stay positive in the doom and gloom news that we see today? And what thoughts?
For me, when times are tough, and times have been tough, and the kind of the Flint story, and since then, for me, it's a daily practice of kind of asking myself why. And I kind of touched on this already. When the state was going after me and like ridiculing me and telling me that I was causing hysteria, which is sexist, and saying I was wrong, and I knew I was right, and my kids were in harm's way, I felt it was hard not to feel defeated. It was hard not to feel like tiny. And I think, as so many women, there was also a sense of imposter syndrome. Like, what? Like, maybe I don't know what I'm talking about. And what quickly got me back in the fight, and what lifted me up, was a reminder that it wasn't about me. Like, all of us in health and healthcare, we didn't go into this field for the paycheck or the prestige or the power. We went into this field because of the people. And for me as a pediatrician, those people were my kids. Like, my kids in Flint are no different than my kids. They're my kids. And I think when we are able to kind of ground ourselves with that why, like, remind, that this is not about us personally, but this is about something bigger than us. This is about the collective us. That automatically lifts me up. I'm still a practicing pediatrician, and I love seeing patients. I was in clinic the other day, and there was it's well child season, it's the summer, and there was a 4-year-old for their well check, and I'm like, hey, you're 4, and I ask almost every kid, like, what do you want to be when you grow up? And it's usually like basketball player, sometimes doctor, but some athlete usually. And I'm like, what do you want to be when you grow up? And there's a 4-year-old, and a 4-year-old's like, I want to be 5 when I grow up. I'm like, yes. Like, how can you not love these kids and these children and these patients that we are privileged to care for? And especially kind of as a pediatrician, like, it's my job to make sure that my patients are healthy today, but more importantly, like, it's my job that my patients can realize those dreams, that they have a healthy tomorrow. And like someone just said, generations of healthy tomorrows. So I think, when I'm actually able to like have that one-on-one with my patients, but also, just ground myself with that why, that our work is about people, that's what gets me back up. And what also motivates me and keeps me going and keeps me so excited is all of you. Like, OMG, like you guys are, everybody here is doing amazing work. The fact that you are on this conference on a Saturday, giving up probably personal time. Wow, the innovations, that's work that's happening in Kansas, all over, like that's wow, that's amazing. The young people, medical students and undergrads and high school students, they are sick of the status quo, and they inspire me to create change. A lot of the things that are happening, we talked about these resolutions, are being driven by our young people in healthcare who are sick of older folks not addressing these changes and recognizing that things like racism and voting rights and civil rights and women's rights impact the health of our patients. So I am inspired by it so much. But somebody asked about burnout, and I'm going to give you kind of my tips about like kind of how to combat burnout. But first of all, like, stay grounded in your why. Remind yourself, like, it's a daily practice for me, like, why, and I ask myself that why. But especially for kind of advice I'd give to younger folks who, oh my God, care about so much and care so deeply. I've got kind of a few tips, and my first is like, find your passion. Like, what is your why? Like, what do you care about the most? Is it democracy? Is it climate change? Is it women's rights? Is it immigration? Is it, what is your why? Because I think it's good to have a focus. Otherwise, it's easy not to get overwhelmed by all the stuff that's going on. So find your passion. Find your peeps. You guys are my peeps, okay? Find your village. We've heard about villages. This work is not solitary work. There's other people out there that care about the same stuff that you care about. Find your village. And in topics like civic engagement, they're not going to all be in health and medicine. And health and medicine, we often are very siloed and hyper specialized. Find your peeps in unexpected places. My work in a lot of children's environmental health and water, like, my best friends are engineers. Like, who would have thought a doctor's best friend would be an engineer, and environmental lawyers and other folks? So find your village. This work, there's ups and downs. You need your village to lift you up when times are hard, and you need to be there for them. So find your passion, find your peeps, be persistent. We've heard a lot about persistence and not accepting the answer no. Keep at it. Policy change, any change happens in windows of opportunity. If it's just change to, get your EMR to add this question, or to even be allowed to talk to residents and doctors or the medical staff, be persistent in your asks, come with evidence, be prepared. That's my last P. Being at this conference is preparing you for those conversations, preparing you for those moments. Role playing, all these other stuff is preparation. So that's kind of the advice I have kind of for burnout, is find your passion, find your peeps, stay persistent, and be prepared. And you guys are doing all of that.
And we have one of our dear friends, Stephen Inc., on the call, and wanted to share, he also wanted to share a quick story about burnout. So I'll turn it to him, and then I'll close with a quick lightning round. Patricia, I'm going to answer your question in the chat.
Thanks, Aaliyah. A follow-up from a question I asked yesterday about using the after visit summary idea at a health fair. So there was a African-American wellness walk in our town today, and participated in the health screening area. Photocopied about 1,000 of these slips of papers and handed them all out. There were many people who were already registered to vote, but when I made the call that you can share this with family and friends, a lot of eyes perked up and bells went off inside, so they can be advocates. It was so inspiring. I wanted to just quickly share that. Thank you.
Thank you. Thank you for all that you've done in bringing Vot-ER and voter registration work to health fairs. It's something that we've now been trying to make sure we do in other spaces and other communities as well. So, all right, quick lightning round to wrap us up, Dr. Mona. What is your Starbucks order or your coffee order?
A flat white.
All right, cool, awesome. How do you unwind and decompress?
I read a lot. I have a book with me all the time, and I think as an author, I wouldn't have been an author if I wasn't a reader, but I think a reader is reading is so important. I think that's what gives me this level of empathy in health and medicine. You get to step inside someone else's shoes. And I think that's where I've been able to learn so much about the history that we were never taught. So reading, I love reading.
Absolutely. Who's your role model?
Oh my gosh, I have so many. One of my role models is this badass woman named Alice Hamilton, who a century ago was a lead expert. She was the first woman professor at Harvard. She worked with James Adams at the Hull House. She was always going against powerful forces on behalf of the most vulnerable and children. And she was always using science and media to her advantage.
And last one, if you could have dinner with anyone, past or present, or imaginary, who would it be?
Oh my goodness. That is a great question. And I don't know who I would have dinner with. I don't know, but it's probably like an animated character as a pediatrician and mom. I love animated characters. So I'm gonna leave you with a quote from another doctor that is kind of my parting words for all of you. And this doctor said, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So who knows who that was? Dr. Seuss, the Lorax. Okay. So those are my parting words, Dr. Seuss. Yeah. So those are some of my inspirations, and that's just my take home message to all of you, that you got this, you can do this. It takes one person to literally raise their hand, to ask questions, to do the scary thing, to create change in their communities. And you know, that's my story, and that is absolutely your story. I am just like every single one of you out there.
We are fired up, Dr. Mona. Thank you so much.
Thank you.